presentation from USAMA Azam Khan Khatak. USAMA is a doctor of clinical nutrition by profession, and he holds a master's in public health. He is the General Secretary of the Hemophilia Society Rawalpindi chapter in Pakistan. USAMA worked on an advocacy project which is related to obtaining disability cards for people with hemophilia. We actually had 3 participants from Pakistan Hemophilia Society in the academy this year. So they work together on this project, and USAMA is presenting on the behalf of the whole team. So USAMA, handing over to you.
Hello everyone, this is USAMA Azam from Pakistan. First of all, I would like to thank WFH for providing me this opportunity. And now, what is my affiliation with hemophilia? I am a hemophilia A patient, and I am working as an executive board member of Hemophilia Foundation Pakistan, as a general secretary of Rawalpindi chapter of Hemophilia Foundation Pakistan. Now I would like to tell you about Special Person Card, which is the subject of my PACT Academy project. I have no conflict of interest, and the data and pictures shared in this presentation have been consented by all patients. And now what is Special Person Card? Mostly hemophilia patients have to replace the deficient factors on daily basis, but in Pakistan hemophilia patients are usually on demand treatment, and due to on-demand treatment they develop joint disabilities with the passage of time, and which affect impact their education and employment, their social life. It doubled their you can say that suffering of patients here. So Special Person Card helps in free education, job. I would like to tell you about what Special Person Card. Social. We can say that the social suffering to less. It is a government of Pakistan project for the people having a physical, mental, and any other disability. And a person having this card has free access to higher education. He has access to subsidized daily social services, treatment provision by government, and jobs as well. The main objectives of this project are that we want our patients to become self-reliant. This project was aimed to strengthen the autonomy of our patients, so they have access to education. As I mentioned in the previous slides, that on special seat they will have entry to higher educational institutes. They will have access to job opportunities, treatment provision by government, and social services. So the expected results of this project are, we are expecting that our patient will become self-confident. They will live a normal life. Their suffering will become, you can say that, little bit cure after this project. So the same, they will have entry in higher education institutes, jobs easily, and treatment basis on this card. Yes, this I will mention here that when I was applying for this card, working on this project, I came to know that government mentioned on this card that what this person is suffering from and what is the treatment he needs. So in future we will use this data for the advocacy projects on the basis of this card. So key activities. Now I would like to tell you about the steps that we have followed, that we have taken during this project. There are few stakeholders of every project. In this project, patient himself, patient with hemophilia, he is the main stakeholder, and other stakeholders like healthcare professionals, our society staff, social welfare department, the other departments. We have conducted 5 meetings at, and this picture shows one of the official of the government, and along with patients we are trying to convey our message so he can understand it, why we need this card. So this was the main step, the meeting with stakeholder, and this is is the picture of the patients having hemophilia. As I mentioned in the previous slide, that patient himself is the main stakeholder. But in developing countries like Pakistan, mostly patients, they are unaware, and secondly they don't speak for themselves. So we plan that we will arrange workshops, and will teach them, will train them so they can speak for themselves. So the second main, you can say, pillar of this project was workshops to mobilize patients, and in this, two mentors from my society, Dr. Taira Zafar and Dr. Lubna Zafar, they helped me a lot. Now, progress to date, you know, till date we held 5 meetings with the stakeholders. The stakeholders I mentioned in the previous slides, and during these meetings, I tried to tell them that. I tried to convey them the message that why we need this card, and I am happy to announce that, or to tell that we are now, you can say, successful. We have achieved this, that hemophilia is included as a cause of disability by the main stakeholder, and our first patient, the star case, the disability certificate is issued to him, and this is the most important progress to date. Next steps, in every project, follow up is the main important thing. So we will have routine follow-up meetings with the stakeholders, with our patients, and the initial certificate, as I showed in the previous slide, entry of that by the National Database Organization. And under this project, under the first phase, we will work for the 50 patients of Rawalpindi chapter and other chapters to receive these cards. So upon request of Dr. Taira Zafar, she said that also add this. It is very encouraging. This is the few high achievers of Hemophilia Society Rawalpindi. This is me. This is my educational qualification and designation I'm working on, and this is my one other colleague. She is a VWD patient. She is a registered medical practitioner. Now, thank you so much, and again, Teachers of PACT Academy, this was a wonderful experience.
Thank you, USAMA. I have heard of similar programs where people with hemophilia have access to social benefits, let's say in some other countries. And I wanted to say that obviously I think we all want ultimately to see a day when all people with bleeding disorders have adequate access to treatment and care, and who don't have any disabilities or other health burden or disease burden caused from living with a bleeding disorder, with a condition, and can enjoy full and productive lives. But reality is that this is not the case today, so having access to some social support programs can definitely be an important help and benefit for patients. USAMA, I'm looking here at the chat and the Q&A. I had a question. In your project, you talked about, and obviously you came up with this target of 50, and I'm sure that you did some collection of data, and when you were assessing what should be the what number you should be aiming for. So what data did you look at, or how did you use data to make the case for your project to convince the authorities?
Yeah, initially I was working for the people of older age, like you can say that above 30, because their suffering is more. In Pakistan 20 years back, factors were not available, and they have more disability and more joint deformities. So I'm working for them that they will have jobs, you can say the desk jobs for them. So initially the 50 patient, as I mentioned, these will be you can say have some joint deformities and above 30 of age.
Above 30 of age. Okay. Thank you. There is a question in the chat. What additional treatments are cardholders able to avail of from the government?
Yeah, any sort of treatment you can say, but the main important thing is, as I mentioned, that when government issue this card, they mention on that card that what is his suffering, why we are giving him this card. So in future we are working on the procurement of factor 8s and these products by government. So this data will be used in these projects, and the other treatment you can mention here for hemophilia patient is hepatitis C, HIV. These treatments on this card, these are easily available.
A few months ago, this reminds me, there was in the news, in the media, the information on the cases of contamination, I think due to not having access to safe treatment products in Pakistan, and I probably, that's why you're specifically mentioning the access to these treatments for HIV or hepatitis. Is this could be an important benefit for patients to have access to it?
Yes, you're right. A few months back, when we test our patients, about 40% were tested positive for hepatitis C in our Karachi region.
40%?
Yes, in Karachi region. I am in Rawalpindi region. Our patients are they are not tested yet, but in Karachi, 40%. It's 40%.
It's a huge number. We have another question on USAMA. How easy or difficult was it for your government to listen to your proposal, to accept it?
It was very difficult, but the main, you can say, what of the more important benefit I have right now. I am patient of hemophilia, and I am a healthcare professional also, a student of public health. So I am, you can say, I'm trying my best to tell them that what I need, and they are right now. They say what I can say. It was very difficult. It was very difficult because after initially government has made an amendment in our constitution. After that constitution, the federal government is not dealing with healthcare. Healthcare is dealt by the provincial governments, and the other two colleagues of mine, Wajiha and Abbas, they are from different regions, and it's very difficult for me and Abbas to meet right now because he is far away. So it was very different to work at federal level, but at provincial government it was easy.
This leads me to one final question, and in terms of advocating, let's say in one province, and when healthcare is decentralized, do you plan or to, as an organization, to replicate in other provinces or a similar project?
Yes, Wajiha and Abbas will replicate. This is the data I have shared is of Rawalpindi chapter, and the patient selected right now is from Rawalpindi chapter, but the other colleagues will replicate it in a month or two in their regions. And then we will use that data collectively for a federal level, on federal level. Yes.
Wonderful. Well, thank you very much, USAMA, for sharing this project, and on behalf of the whole team, the three of you, for participating from Pakistan Hemophilia Society. So now.